This segment is sponsored by MD AcuMed Integrative Health. Nobody wants to go through life living in pain, and sometimes it can be hard to find the root cause of your discomfort.
But our next guest is dedicated to treating the root cause of your pain, not just the symptoms. Joining us now is Dr. Stephanie Johnson of MD AcuMed Integrative Health. Thank you so much for being here.
Well, thank you so much for having us here today.
I know people in pain really want to hear how you got into acupuncture even to start. Where did you find it?
So I had a car accident and injured my back, and I'd be holding our newborn and my legs would just give out. Bam.
Oh, that's
no
scary.
warning. I'd be on the ground, and then I'd be laid up in bed for like a week or two, and debilitating pain. I was terrified I was going to be able to walk. I tried everything. A doctor told me I needed surgery, and then a friend suggested acupuncture. I thought it was a bit woo-woo, but I gave it a shot. And from that experience, I knew that I wanted to help people get out of debilitating pain.
How does acupuncture work? How would you describe it? Like, it's usually not painful, right? I mean, you might feel, I know I've done it, and if it's like a really big trigger point, like you might feel a little bit, but it's not painful at all. How does it work and heal your body?
So, acupuncture, it's real simple. It works by inserting tiny needles into the body to release the neurotransmitters that help to restore balance and help promote healing in your body. At our clinic, we are known in the community for treating chronic, difficult to treat conditions. So like peripheral neuropathy, chemo-induced neuropathy is a big one. Autoimmune issues, women's health, allergies, and weight loss. So when somebody comes into our clinic, say with peripheral neuropathy, they're often told, you just have to live with the pain.
Ooh.
And
nobody wants that.
No one wants that. We had a patient come in who had 80% sensory loss in her feet, and we were able to get it down to 23%.
Oh, wow.
Wow.
Life-changing for her.
What do you do differently at your clinic from other places that also do acupuncture that's helping people like this?
So, it all starts with the first treatment. And because no one's the same, no two patients are the same, we customize the treatments to your specific needs and what's going on. So we're able to do that with AcuGraph, and that's what we're demonstrating here today with my colleague Darren and our patient Catherine. And this enables us to see a baseline report of what's happening in the body, how it's functioning, what's out of balance. So when you have things on the chart that are blue and red, it tells us what's out of balance. And as we all know, when we're out of balance, real healing can't happen. So, we're able to get really amazing results because we're treating both the acupuncture pathway as well as the pain. So, I just say life gets better when you get acupuncture.
Right, and it seems to be just more accurate, and you're able to more specifically treat, right? And maybe it helps it faster, it helps it more efficiently.
Absolutely, because we're able to really target what's going on with you, what's going on with you, and it gives us this great picture of what's happening in your body, and it's a great visual that you're able to then also take away with yourself to look at later too.
Yeah, I like that you listen to your patients. I'm sure you have a lot of patient success because of that. Anyone that you particularly highlight who was a really great patient for you?
We have so many great patients, and today we have Catherine here, who is one of our patients, who's going to share a little bit about her experience.
Yes, thank you, Dr. Stephanie. Acupuncture has been critically helpful for helping my abdominal pain because of endometriosis and my overall mental health and clarity. Because of the AcuGraph report, I have a tangible report that I can look at that gives me a full body view holistically.
Thank you for sharing that. It's amazing.
It's amazing. And what we find is after people have like a series of treatments, then that's when the real healing begins. And our patients say, their pain goes away and then other things improve. So they get better sleep, they have better digestion, they're calmer, they're less stressed, they have an increased libido. Like, who doesn't want that, right?
So it's like things you don't even expect. You just want the pain to go away, but now your whole body has improved and your health, and it sounds like your life too.
Absolutely. It truly can be life-changing.
Wow.
Well, Dr. Johnson, thank you so much for sharing this, and just we were sharing, I can speak to acupuncture really helps too, so I hope people check it out.
Wonderful. And we have we often tell people that when they come in, one of the reasons why they'll come in is you've tried everything else, you are living in daily pain, and you want to get out of pain. So
Well, here's how you do it. You can set up a new patient consultation by heading to mdacumed.com, or you call now and get a new patient consultation and an AcuGraph report that we were just talking about for $40. The number to call is 301-592-9355. Again, give AcuMed a call at 301-592-9355 for a new patient consult and also an AcuGraph report for just $40.